What is going on, everyone? This is Dr. Josh Funk, and you are listening to the Strength and Knowledge Podcast. What's up, everybody? I am Dr. Funk, and I'm here with your favorite Chief Clinical Officer and Residency Director at Rehab to Perform, Dr. Zach Baker. Welcome, Zach. We're going to be diving into everything residency today. For anybody who's unaware, we've been doing the sports residency now in our second year. We have 2 residents finishing up. We also have started an orthopedic residency that we will be starting and are taking on our first resident right around Labor Day weekend. But Zach has put a ton of time and energy into creating this program, creating opportunities for people to become board certified. And we are going to speak to the 2 different options themselves and also discussing what the informal route looks like. Pros and cons to everything. There's different roads to Rome. I mean, especially when we talk about a situation right now where Zach did not go through a residency to earn his board certification. And actually everybody who's board certified at our company, with the exception of our first sports resident, has gone a non-formal route. But we will have more and more people who are board certified either as a result of the residency program or through non-traditional means, just kind of doing it on their own. But who better to dive into this topic with than you today, Zach?
Yeah, this is a topic that's obviously of interest to me, just with my direct role as the program director for our sports residency and assisting with Tim Bifolco, who is leading the charge with our orthopedic residency. And this question and this topic was really a question that I had received on Instagram where somebody had asked, should I pursue OCS versus SCS? And then the second part to that is, how do I even know if I should or should not pursue that? So I think the big reason that a lot of people do pursue residency education is that they're either trying to demonstrate mastery or competency within a given field, and they are hoping that that then parlays into further professional avenues that they can go, whether that's academic as a faculty route, whether that has to do with more professional speaking, or maybe that has to do with something with regards to getting their foot into the door with a job or an organization that otherwise wouldn't have been available without that. And I think that's where a lot of times with the sports residency, that can get your foot in the door with different collegiate and professional teams that if you don't have residency training, you don't have an athletic training background, it may be a little bit more challenging to navigate that. Now, with this, Josh had also mentioned that you can go more of the traditional route or the independent study route. So the traditional route is one where you are actually going with a sponsoring organization and you are having them take you through a guided curricular and mentorship experience in order to help prepare for sitting for the board certification exam. Whereas the independent route is you do self-study and you accumulate your clinical hours and you accumulate all of the different prerequisites, which can be found on the ABPT-RFE website, and then you sit for the exam on your own. Research has shown over the last 6, 7, 8 years that individuals that do the more traditional route have a higher pass rate on the exam on first attempt than those that go the independent route. So a lot of people do choose the more traditional route just because there is a higher success rate with passing the exam on the first try. And I think oftentimes that just comes down to structure and accountability with what your didactic and curricular material look like. Other people choose the more traditional route because they really crave that more one-on-one intimate mentorship component that comes with that as well.
And going back to, I mean, when we were coming out of school, the process has changed drastically. The pay has changed drastically. Correct me if I'm wrong, but I'm pretty sure most residency programs when we graduated were free. We were like free labor. And it has evolved to a point where a majority of places that I'm aware of will pay people based on the amount of caseload that they're taking on. And that is something that we have matched as well, starting out with an 80% caseload and then allowing residents to actually work themselves up towards a full caseload with a salary for a new grad being something similar, because all of our residents have largely been new grads. They've come to us right after finishing up their PT school. What are some considerations that you also had to go the non-traditional route, doing it on your own, and why SCS over OCS?
So in regards to the traditional versus the formal route, like you had alluded to, I graduated back in 2012. So that was about 11 years ago. And the number of residency programs that were out there was not nearly as many as there are today. And the options that were out there geographically were not close to an area that my wife and I planned on living in. So it just wasn't something that was going to be an ideal fit. She was already in her career where I envisioned mine taking place, was not one where there were any sports residencies nearby. So that was when I decided to go the independent route. So I think things you need to consider: is there a residency in a location that matches up with where you could see yourself living for either that short term or long term? And then also, like you had alluded to, finances. What does that look like? Are you graduating with a lot of student loans and a lot of debt, and foregoing the beginning of your career for another year or two is going to put you just in a position you don't want to be in? Or are the different residency programs that you're looking at, do they offer you a compensation package that matches up with allowing you to do the other things personally and professionally that you would like to? So that was kind of considerations for me. Geographically, there was not one that really matched up with where I wanted to live, and I just wanted to start working. Preparing for the test and all of that, I was kind of in line with what expectations were with that, but that is something to also consider. Are you somebody that can stick to a plan, and can you leverage your resources, or find other people who are going through it with you as well and create a study group? Or are you somebody that needs to be in a more formal avenue with regards to mentorship and studying to keep yourself accountable for that? Going back to the compensation, like you had mentioned, every residency program will have their own formula or way that they go about determining what that pay looks like. But like Josh alluded to, a common theme that you will find: the amount that you are paid is typically going to correlate to the amount of time you are spending doing clinical care. Meaning, if a standard week is 40 hours in the clinic for a regular full-time PT, if you are doing 20 or 25 or 30 or 35 hours, your pay is most likely going to reflect that pretty close to what a percentage of that will be. You'll find some exceptions to that rule where you work a lot and you still don't get paid as much as what you think. And you'll find some others where maybe you're spending less time in the clinic, but you are getting compensated at a higher rate than you would think. But I'm sure there are going to be other roles and responsibilities. Maybe you are doing some teaching or some academic involvement, acting as a grad assistant, or filling other roles from a research standpoint with that as well. Second part of that question, OCS versus SCS. How do you figure out which one is for you? Obviously, if you're working in sports medicine and a sports-based outpatient clinic, you are going to see orthopedic cases. So there's a lot of overlap with regards to the didactic material, with regards to injuries you're covering, and some evaluation and plan of care. With regards to the OCS and the SCS material, the OCS material does tend to get a little bit more into the weeds with regards to really optimizing best plan of care based off what the current literature suggests, utilizing the different clinical prediction guidelines and rules, whereas the SCS, the big delineating factor with that is you are going to get more exposure from a curricular standpoint to acute injury management, emergency management, and everything that entails with pre-participation screening and sports venue coverage, in addition to the obligation to perform sports venue coverage under the guidance of either an ATC, physician, or SCS individual. So if you want to work in sports and potentially on a sideline, SCS is the way to go for that. If you are looking just for additional education and additional mentorship and credentials in an outpatient environment, I think OCS or SCS would be appropriate for that. But the involvement with sports, mainly sports venue coverage, is the biggest delineating factor.
Thanks for sharing that, Zach. And for anybody that wants to either choose an orthopedic or sports residency, Zach has made the rounds and made the connections at a ton of different places throughout the United States. He could provide you with insight on our residency programs, as well as maybe some other options that honestly might be a better fit for you. Also, for anybody looking to start their own residency program, there is no secret who put a ton of time and energy and the legwork to making this a reality, and that was him. So if you have questions about residency programs, whether or not they're a good fit for you or not, whether or not our residency or another residency is a good fit, or just the overall process, definitely reach out to Dr. Baker at rehabtoperform.com or reaching out to him on Instagram at ZDBaker30. But Zach, thanks for your time today, and I'm sure you're going to have some people reach out soon. Thank you for listening to the Strength and Knowledge Podcast. If you enjoyed this episode or have been tuned in for multiple episodes, we would love for you to subscribe, rate, and give us a review on Apple Podcast or Spotify. Until next time, thanks for listening.